YouTube and Instagram. I hope everybody joins in early so that we can start. First, I'll start discussing one of the case which I had recently about last week only, about 5 days before only. A very interesting case so that nobody has to repeat the same questions again and again. Let me tell you that I, when we started our YouTube videos or Instagram videos, we had about very little question, few questions. Now the number of questions basically are increasing. So it might happen that owing to the increase of question, I will basically sometime answer in the next YouTube or Instagram live. Okay. So sometimes I'm not able to answer all the questions because of the increasing questions. So welcome Dr. Gaurav and yes. So there was one of the questions which was asked by one of the I had one case just now. First, I'll tell the case, then I'll basically start the question sessions. I had a case where the patient complained simple case of lot of distension of abdomen. There was lot of distension of abdomen. Hello, Dr. Babel. There was a lot of distension of abdomen, and the patient said, especially, and he said that it is 24/7. Whenever I eat, whenever I drink, if I don't eat and drink, also the distension is too much. And this has been since about 8 to 10 months. I have taken all the medicines with no change. On probing the case, we found that the distension was more after drinking water. The distension was more after drinking water or drinking anything fluid, it says. So that now we started again thinking what remedy to give, and of course matching the other symptoms of the patient. So we had, yeah, I'll just answer the question after I finish this case. Dr. Vasim, welcome. So distension of abdomen after drinking. If you see a mathematics, of course, whenever abdomen comes in, whenever distension of abdomen comes, three remedies which we always should remember is Naxomica, Carboid, China, Lycopodium, three four remedies. But in this case, we had given the patient China with no change, but then we prescribed the patient the remedy petroleum. And with petroleum, just 5 days before the patient came, the patient is much better, which he was not since past 8 to 10 months. Now, this is how the Matermedica symptoms help us to treat such type of cases. Otherwise, normally we use our basic remedies of distension of abdomen, and basically we get some partial result, but not total result. This was a very interesting case, distension of the whole abdomen after drinking, and the patient had a lot of nausea and there was a lot of accumulation of water in the mouth, and that's how we prescribed the patient petroleum. I also had prescribed China before petroleum, but it failed, did not work, it only worked temporarily. So this is the importance of understanding Mater Medica, and then repetizing and then using the knowledge of Mater Medica to prescribe. If you have been watching my YouTube videos on skin, I have taken some polycrest remedies also and some rare remedies also, where I am able to differentiate skin remedies, and those are very important. And if you have seen my case of a violent case of dysmenorrhea, and I had cured that case with Cactus grandiflorus. Normally, we never think about cactus in case of dysmenorrhea, but on carefully repetizing the symptoms, we came to cactus, and cactus worked wonderfully and cured the case. So this is the importance of repetization. This is the importance of understanding Mater Medica. After you repetize, there are 3-4 remedies that comes in a repertory chart, and then your Mater Medica knowledge helps us to differentiate the remedies. So welcome Dr. Kritika, Dr. Arman Khan, Dr. Almagiri, Dr. Wasim, Dr. Anisha, Dr. Palak. Dr. Mende has a question. What remedies to give after lycopodium that says distension abdomen? Yeah, so I was just telling you the case, so don't immediately ask the same thing, because what happens, we are just trying to be clinical more rather than more of theoretical. Now, after lycopodium, the distension of abdomen, I cannot say the remedies, because it depends upon symptoms, Like for instance, I told you the case of distension of abdomen, and I did give China, it failed because it's a routine perception, And then when we probe the case, we probe some more symptom, and then we come to know that it was a case of petroleum. After lycopodium, what to give, I can't tell you, but I can tell you some important things about lycopodium that you should remember. Okay. In lycopodium, one thing is very important, After eating, there is pressure in the stomach. After eating, there is pressure in the stomach. And what was there in that patient? After drinking, there was bloating in the distension of stomach. So lycopodium, where after eating there is pressure in the stomach and there is a bitter taste in the mouth, that is lycopodium. Okay, and a lycopodium patient basically desires sweet things. That's a very, very important symptom of lycopodium stomach. And one thing in lycopodium, the patient wakes frequently at night because of the stomach problem. And of course, then the few mouthful fills up the throat and lots of other things. That's why in lycopodium, if you want to differentiate, think that the patient likes to take food and hot drinks with it. Garam pani pita hai, so he feels better. That's how we'll differentiate lycopodium with petroleum or any other remedies. I cannot tell you after lycopodium what to give because I don't practice this type of symptomatically. Good afternoon, Dr. Disha, Dr. Sangma, hi, Dr. Yeah, good afternoon, Dr. Paulsam. Yeah, okay. So this is the importance of lycopodium. If you go in lycopodium in detail, yeah, Dr. Jyoti Vaishnav, good afternoon. So if you go lycopodium in detail, so lycopodium has other symptoms also which are important. If you okay, just a question first. Fever, body is hot with chilliness, burning eyes, and body ache, throat is burning. In this case, see what is important: fever, body is hot with chilliness, burning in the eyes, body ache, and throat is burning. Now, this is a very important symptom that everywhere there is burning. So, in this case, I don't know what remedy you think about, but do think about 3-4 remedies which are very, very important. First, think about arsulflavum, then think about China ars, and then think about sulfur. These are very, very important remedies in this symptom. And then, of course, depending on the severity of chilliness or depending on the severity of hot feeling, then you can differentiate other remedies. One World 007, welcome. Good afternoon, Dr. Singh, Dr. Bilwalkar, good afternoon. So this is how you differentiate. In fact, I differentiate my Matermedica. Same as I told you. If you see China, now China has all the symptoms of Matermedica, of stomach symptoms, but again, China has few symptoms which are very, very particular in its therapeutic. Like in China, it is said that there is a lot of feeling of weight after eating. And in fact, China has a very important symptom which you can see in a day-to-day practice, and that is ill effects of drinking tea. चाइना को चाय पीने से तकलीफ होती है and milk disagrees in China. So this is all whatever I can recollect with my terminology of Matermedica, and there's a lot of flatulence and bitter fluid and regurgitation, and food gives no relief, and China patient is worst after eating fruit. So this is how you differentiate China, lycopodium, and petroleum. Patient suffering spinal injury followed by heart attack. Okay, apoplexy, crotal horror, but good success. However, few days later, streptococcal infection followed. Suddenly became weaker, apathetic, antibiotics given. See, whenever you feel crotal horror is fantastic, nice result. However, condition didn't change. Thank you, Aurum case for international London group. Gave Aurum 2 days ago with immediate awakening, more strength, speaking, participation life. Fantastic, Dr. Barbel. Very hopeful. Next time we'll show if it is consistent. Thank you for sharing your experience. Okay, very nice, and thank you for sharing the case so that everybody learns from this case. And treating cases which are far away from India, and then you get some change. So it feels really nice that you are able to expand the knowledge, and the patient is getting relief. That is important. So well done. And or a metallicum we'll discuss later maybe. And the spinal case of crotalis horridus, maybe in that case, crotalis horridus should have been repeated so that the immunity should not have gone down, and the body should be able to fight that streptococcal infection. But still, okay, well tried. And case of Aurum, best of luck. Yeah, Shaheen Zeba, welcome. Next, dry cough, more on talking, more at night and with irritation. Now, I think this question should be answered by everybody. Dry cough, okay, and the patient is aggravated by talking. In fact, in these days, we have got a lot of cases of cough and cold which are not healing, very fast. Viral are not going so fast. But I think everybody should be able to give this answer. Tell me, dry cough, talking aggravates. Anybody? Sparkling seminar, welcome. So Dr. Polsam has one question. Dry cough, talking aggravates. I'll give you two remedies. You all at least share your experience. First, you should think about hyoscyamus. You must think about Rumex crispus. Any other remedy that comes to your mind? I have about 4 or 5 remedies lined up, but I would like everybody to answer this question. Simple question, dry cough, more on talking, more at night. Simple. Anybody? Yes, anybody? See, whenever you arnica, no, arnica, we are telling dry cough, more on talking. No, not belladonna. We have to have very, and she has written more at night. Now, when you have more at night, no, not Kalimur, not Naxomika. There are 3, 4 remedies which are very, yeah, Rumex I told you, Bryonia. See, if you have dry cough, aggravation by talking and aggravation at night, there are 3, 4 remedies very important, not Bryonia, not Drosera, not Conium, not Lachesis. 2 remedies I have told you, one is Rumex crispus and the other is Hyoscyamus. Belladonna is there, Lachesis is there, Hippalsulf is there, Manganum is there, and Pulsatilla is also there. Yeah, Pulsatilla is there. Causticum is not there. Of what I have, of my knowledge of maternity, what I'm telling you, Blata orientalis is basically not aggravated. Causticum is not there. So she has 2. So write down, Dr. Sangma, it is Hyoscyamus, Rumex, Hippalsulf, Belladonna, Lachesis, Magnum metallicum, and Pulsatilla. These 7 remedies are there exactly. And when we cover both the symptoms, so then you have to differentiate the patient. Patient is thirsty or thirstless. If you have thirstless patient, then only 3 remedies come. That is Pulsatilla, I think, and Magnum metallicum is also thirstless. If the patient is thirsty, then 4 remedies would come. That should be Hippalsulf, Hyoscyamus, Lachesis, and Belladonna. If the patient is chilly, then it is normally you get patients who are chilly. If the patients are chilly, then Hippalsulf, Hyoscyamus, Belladonna, Rumex, lot of remedies there. But if the patient is hot, then automatically your area of maternity decreases. It is Lachesis, Pulsatilla, and Sternum metallicum. So do think about these modalities and these thermals and thirst, and you'll be able to correct that case. Okay. Manganum metallicum, MANG, Manganum metallicum. Dr. Vansh, Dr. Gaurav, Dr. Ranjan Mukhia, welcome. Yeah, Magnum metallicum. These are very interesting remedies. Go home and at least read these remedies. Will definitely guide you in your practice. Magnum metallicum, I think I must have told you in one of the in one of the YouTube sessions or one of the sessions of cough. Magnum metallicum has a very important symptom in relation to cough that everybody should know. I'll not give the answer that I have told, I think, to this symptom in lot of my YouTube videos and my cough videos. So, okay, we have long list of remedies: Spongia, Croton tick, Causticum, Pulsatilla, Drosera, Conium, Rumex. That's the beauty of homeopathy, one symptom and we have so many remedies, and that's why your application of Mater Medica sometimes becomes important, because some symptom and some modality you should remember. Okay. Let us go to next question. There is some question on Instagram, and that was I'm seeing. It has got scrolled up. So if I've forgotten to answer, do write it again. One more case: loose stools and feeling very fatigued. You told arsenic 1 2 dose. Patient much better now. Very nice. And of course, the case Dr. Sharon appears very easy. Loose stools and what's there, arsenic will heal. But then when you cure a case, it feels really great. So thank you for sharing. And arsenic was there with fatigue. It's an acid, so fatigue should be there in acids. Dr. Sharon, yeah. So we had wonderful case sharing with Dr. Babal, with Dr. Sharon. Let's go further. Whenever you are, if you have no questions, I'll continue that part. Whenever if you have cases, when the patient comes and tells you that it is aggravated at the night, you must then see the aggravation which part of the night. Okay, we have a question, so I'll not. Children, those who have having running nose whole year, which is yellow. If the patient has, running nose the whole day, and if it is not affecting the patient, let it be. It is a soric symptom, so don't treat. Otherwise, there are a lot of remedies, where the discharge from the nose is like yellowish in color. If it is hampering the patient, just treat that. Otherwise, just leave it. Soric symptom, no need to basically prescribe. But still, if you think that it should be cured, the discharge is yellow, then 3-4 remedies which comes to my mind with yellow discharge is Calcarea car. I think iodum is there. I think Cicuta virosa is there, and I think Kali bichrome is there. So these 4 remedies of whatever I can remember when the discharge is yellowish and chronic in nature. Sir, your COVID-19 dose also working nicely in viral cases coming nowadays. Yeah. COVID-19, we had forgotten that COVID-19 dose. So, it's definitely working in these viral cases. And thank you for sharing your experience, Dr. Sharon. I have a question. Dry cough, night aggravation, what can we think for? See, as I told you, dry cough at night, there are lots and lots of remedies. If you open the repertory, once, and you will have about hundreds of remedies. Just try to differentiate which part of night, that is very important. Otherwise, you can write down the symptoms at night if you want. It is ammonium carb is there, arsenic is there, lacasis, spongia, phosphorus, pulsatilla, sulfur, hipersulf, hyoscyamus, arsenic, lots of remedies are there. Then try to differentiate, the which part of the night, how does the patient react during cough, whether he needs somebody, does not need somebody, does he wake up with cough, doesn't wake up with cough. For first part of the night, he sleeps, then he gets cough. So there are a lot of other symptoms, you have to understand. Children who those are running nose, dry cough, aggression, talking about intense. Yeah, see, whenever you have dry cough, and the patient is aggravated talking, make sure that, when you are having a lot of dry cough and the patient keeps on having problem, and that's why he gets there's sore pain in the body and all. So only that remedy which I told you, plus add semesifuga to that, and plus add Sanguinea canadensis to that. Cervical osteophytes causes pain. Yeah, whenever these, if the cervical osteophytes causing pain, acute remedy that you should relieve, you must think about Lacnanthus, think about Rustox, think about Arnica, and think about Semesifuga. In non-rheumatic patient, lower limb inflammation on standing on soles and ankles with hot feeling, which remedy should taught? See, if it's a case of, if it's a known case of rheumatism, so an inflammatory pain is there on standing on the soles. See, I can give you some remedies, but as I always say, rheumatism basically autoimmune disorder, So if you take the whole case and then prescribe, would be better. Otherwise, symptomatically you can cure the symptoms of soles, and then the whole rheumatic symptom would aggravate, or systemic illness would aggravate. In this case, simple remedy you can think about, Dr. Indranil. It could be Ledampal, it could be Arenia Didana, it could be Squilla, it could be Arnica, it could be Calcarea floor. I have another case, sir. One patient came with piles. I have prescribed nitric acid, but there is no result. Could you share some more symptom of piles? Then I'll be able to answer the question, doctors. Because in piles there are so many remedies you can start. Normally in piles, if you don't get the case, it's simple: blind piles, esculus, bleeding piles, hemimelis, very painful piles, burning and all. Think of Ratania, and burning with discharge of pus. Then you have to think about other remedies, So if you could give me some more symptom, I'll be able to answer that question better. Good afternoon, Dr. Avani. Okay, so no bleeding. So if in this case, if there is a lot of burning and the patient says the burning stays for some time, 1 or 2 hours after passing stools, think about Ratania, think about sulfur, think about Nux vomica, passing stools. So nitric acid would not work in those cases. You think about Ratania, think about sulfur, and think about Nux vomica. Ishika, welcome. In YouTube, some questions have been scrolled up. I think I'll not be able. You could write the question again. Yes. So I hope you understood something about that, night cough and all. Sometimes, the remedies are very, very simple, just few differentiation, and then you must get the remedy. What happens, for dry cough, we have such wonderful remedies like sponge. First of all, whenever the patient comes to us, we normally think about Drosera and Spongia. Hello, Sayyid Mazroor. But there are differentiation between Drosera and Spongia, So every time, just don't think about Drosera and Spongia, Dry. Yeah, I told you, add to that Semicifuga, Belladonna, and Stella Metallicum. Uh, Dr. Mende, is there any medicine to increase appetite in children's? Is least thin but activity is low. Now, see, what happens, Dr. Ansari, if you just want to increase the appetite of children, there are acute remedies, alfalfa is there, avena sativa is there, lecithin is there, 5-FOS is there. So you can try those remedies. Of course, I have not been using this type of remedies now. Sir, one case, patient feels like shock whenever she goes near the metal, which near. Yeah, so maybe in these cases, I have found results with 2 or 3 remedies. In fact, when you are coming down the steps and the grill is of iron, and there's some sparkling and you get the spark. So there are 3-4 remedies you should think about: phosphorus, cuprum metallicum, ferrum metallicum, and titanium. Is there any medicine? Sir, we have used the same remedies you mentioned for dry cough where patient has sit up to relief. Yeah, this is again a very interesting question. Whenever the cough is dry and the patient has to sit up, sitting, and when the patient sits up, it ameliorates. In that context only, doctor, who is there? Yes, Sangma. So we add one more rubric to that, that is aggravation night, aggravation talking, and better by sitting. Now this makes the complete case. The remedies are Hyosamus and Pulsatilla. As I told you, you can add sanguinaria. Hyosamus and Pulsatilla. Of course, Sambucus nigra is also there, but this is exactly important. Dry cough, sitting up ameliorates. With the third rubric, we add to your cough symptoms, So one more question on Insta. Sir, give difference between Drosera and Spongia. I have told so many times, please go to my YouTube videos on cough. I have discussed that at length. And then maybe get back to me on my next YouTube live, because it will be repetition for a lot of doctors. Dr. Maniar, welcome. Sir, right side facial neuralgia by violent rubbing, which remedy we can be think about? Phosphorus worked. See, now this is again a very, very important, disease to treat, neuralgia, and that right-sided neuralgia, and basically trigeminal neuralgia. In this case, it is so important to understand when does the pain occur. That's important. In the morning, in the evening, in the night, while chewing, cold exposure to cold. There are lots and lots of things. But on the prima facie, if you're asking me some questions, you can think about belladonna, Merxol, ferrum phos, rustox, and one remedy you should think about is, I think, Zincum valeriana. BBCR in my clinical practice, normally see, I have been using repertories of complete repertory, Murphy's repertory, Clark repertory, Boric, and Fatak. BBCR basically, if you see BBCR, it is directly, it's basically very concise repertory. I have definitely used that repertory. For example, I had told you a rubric, associated effects, means concomitant symptom which are not present in the book. You must see that rubric, associated effects. So sometimes I also use these repertories if we do not get some symptoms or some rubrics in other repertories. So the use is basically generalized all repertories, but I give more importance to complete and Murphy's repertory, more into Murphy's repertory. Dr. Fareen Sheikh, yeah, welcome. How to treat skin disease, tinea cruris, and other fungal infection. Yeah, I have told you plenty of times, treating tinea cruris and all fungal infections. If Dr. Ansari, you could go to the my YouTube videos which I have taken on every Saturday I take, you will get a lot of answers. And so please do some homework and go to my YouTube videos. You will get a lot of remedies and a lot of things which I have told about this. If you can't, then maybe I'll sometimes answer in the next, because For most of the people, it would be repetition otherwise. Dr. Fareen Sheikh send a request to like video. Okay. I think few questions again in the Instagram have scrolled up. You can always write. So I was telling, yeah, somebody has asked me on Insta. Associated effects, if you have seen the rubric associated effects in Bojara general repertory, pulsatile is there, Merxol is there, Naxomica is there, I think arsenic is there, sulfur is there. These are remedies which have associated effects, The ECG report, lateral wall ischemia and sinus tachycardia. IAB, please suggest. Aya hai, please suggest. Lateral wall ischemia and sinus tachycardia, the remedies are very simple, Whenever you are treating case of heart disease, case of ischemia, where the pulse, are abnormal, or you say sinus tachycardia, you have to think about remedies where the pulse is very, very abnormal, highly audible, Think about spigelia, think about thuja, and think about digitalis, and think about camphor also. How to start the treatment of SLE for incheck? Yeah, I have about 3-4 patients at present in case of SLE. And if you go rubric wise, we have a rubric in elasticity of skin. But I have one patient where I have given the remedy, and that remedy is not in elasticity of skin. In fact, if you try to take the case, it's an autoimmune disorder, So case taking in this case and then prescribing according to the totality is very important. So in this case, either go by that rubric and have some remedies, or case taking. But my opinion should be case taking and then repetization. Sir, COVID-19 nosode you have made is giving good results in viral cases coming to OPD now. Very nice, Dr. Minal. Thank you so much for sharing. And if you could share in which type of symptomatic cases you are using COVID-19 vaccine, so that your symptom and other symptom we can match and make a symptomatology exactly, because everybody should get some symptoms should match. So we can put that symptom 3 marking, 2 marking, 1 marking, So please share some symptoms also in which symptomatology you are using that COVID-19, so that we can expand Termater Medica. Name of remedies: Spigelia digitalis, camphor. Very, very important. Is there any treatment for TVD? Can you explain more, Dr. Ansari, which TVD means what you want to tell? Sir, can we get COVID-19 vaccines for us? Yeah, doctor, I think I have sent a lot of people COVID-19 medicines. You can send me your address. I'll send you some bottles of it. So one case, patient sciatica pain since 2 years and worse motion. Normally, you see sciatica would be worst with motion. And it is 2 years duration now, In 2 years duration, sciatica pain would be a very, very painful condition, and I don't know how the patient is bearing that pain. But whenever if you have case of sciatica, there are few remedies which have SLE. I can't say curable because I have a lot of 3-4 cases of SLE, and they are much, much better. There is no problem of that. There's a microvasculature infarction in the tip of the fingers. The patient could not fold the fingers. Everything is better, but still some symptoms are still remaining. So I was talking about sciatica. There are few remedies which are very, very important. I can tell you, colocynth is there, Naxomica is there, Macphos is there, Hypericum is there, Rustox is there, Medorum is there, and one remedy which has been giving good results now is Tellurium. And believe me, Dr. Fareen, in homeopathy, curable, it is curable. I would say nothing is not incurable. Dr. Shamil George, yes sir, helping me. COVID-19 medicine you take, thank you very much. Yeah, thank you so much. After a long time, I think everybody is talking about the COVID-19. Maybe this type of season, when there is H3N2 virus coming up, and it is definitely working COVID-19, you can try. Just share the symptomatology, anyone who is getting results, so that we can make a proper symptomatic mater medica and give importance to all symptoms. Yeah, use Tellurium when pain aggravates cough. Yeah, Tellurium is there. Pain aggravates cough. Good. If you are basically using, and if you have got these results, thanks for sharing, because somebody might have some other symptoms also to share. But thank you for sharing. Any other? Triple vessel disease, multiple blocks, and doctor, yeah, you can cure that triple vessel disease. Coronary artery disease are definitely curable, and take the case, and it is curable. Don't worry. Okay, sir, will share on WhatsApp. Okay, thank you, Dr. George. So I hope today was a bit of a very fast session, but I tried to cover most of the questions today. It's already half an hour up, so maybe next time join you again on the same YouTube channel. And by the time, whatever you asked me about the tinea curis and the cough symptoms and the differentiation of Drosera spongia, do watch the other YouTube videos which I've shared on the YouTube and my cough symptoms. You'll be able to get the answers to that. Okay. So thank you everyone. Thank you for joining. So until next Saturday. Bye.